My name is Robin Goff. I am a board-certified family nurse practitioner, and I specialize in non-surgical weight loss. I primarily see three types of weight loss patients. The first type is patients that's looking to lose weight without surgery. The second type is patients that are surgical patients that are just getting started on their weight loss journey or are following up after weight loss surgery. And then the last type of patients are lap band patients. I think part of what sets us apart is that we understand where the patients are coming from. So for all patients, regardless if they're weight loss patients or non-weight loss patients, I'll offer nutrition and exercise counseling, medications if it's appropriate for the patient. I can order their labs and x-rays if needed for their weight loss journey. And then I can make referrals to other specialists if need be to help them with medical conditions that may affect their weight loss. Some patients do come in looking initially for non-surgical options, but then later on decide to transition over to surgical options, and that's perfectly fine. Here at this clinic, patients can call us directly for an appointment. There's no need for them going and getting a referral through their PCP. They can just call directly for an appointment. When patients first get started on their weight loss journey, follow-up appointments are going to be a little bit more often, typically monthly. But then after that, as they're further along in their weight loss, then those appointments may be spread out a little bit further. For all patients, regardless if they're having surgery or not having surgery, proper nutrition and exercise is the foundation for weight loss. And then there's medications if needed for both types of patients. We can do labs and referrals for both types of patients. So really, surgery is just an added tool to help those patients. I think some of the biggest hurdles for patients losing weight, some of it is they don't know how to really get started. They don't understand why they have trouble losing weight and what they need to do to lose weight, what kind of changes that they need to make. So I think that that's the biggest hurdle that people have. When the patients come in, we have a biometric scale that we weigh them on. That gives us a lot of information on the patient. It tells us what their fat mass is, tells us their muscle mass, their water weight, but one of the important numbers that it gives me is their basal metabolic rate, which is the amount of calories that their body needs when they're at rest. So we take that basal metabolic rate and we use that to make recommendations as far as what kind of calorie diet that they need to be on. And then we kind of expand on that in regards to if it needs to be a high protein diet or a low carbohydrate diet. With exercise, I'll make some general recommendations. For most patients that initially come in, they aren't exercising at all. So we start off really slow, just trying to help them become more active and not necessarily exercising from day one, but just getting more active. And then we try to expand on that with each visit. Most of those patients are very compliant when it comes to their diet and with their exercise and with follow-up visits. From a weight loss standpoint, I start seeing patients at about age 12 or 13 and up from there. I don't think it matters how long they have been overweight. I think the important thing is trying to get patients healthy. Patients that's been heavy their whole life can still come in and have great success. I have several patients that I see that are past the retirement age that has been seeing me for the last couple of years. So you're never too old to get started in losing weight. We are very understanding of what you are going through, and we are here to help you.